word of prayer. Andrew's going to pray for us. Pathfinders are always ready.
Please bow your heads and close your eyes for prayer. Dear Jesus, thank you for this day. Thank you for waking us up this morning and allowing us to come to church today to celebrate our community and the world around us. Please bless us and keep us throughout the rest of this week. In Jesus' name I pray. Amen.
Okay, so this afternoon we are talking about be kind to your mind. We have 3 panelists here today. What we're going to do is we are going to put questions on the screen through like a Kahoot style, and then you all will answer, and then our panelists will give us further insight into each of the issues. Most of the issues involve mental health and related matters. All right, so let's briefly talk about each of our panelists. Dr. David Defoe is a native of Boston, Massachusetts. He is a self-described Red Sox, Celtics, and Patriots fanatic, but we won't hold that against him. Dr. Defoe is married to the lovely Denise, and together they have a beautiful 12-year-old daughter. He is an alum of Andrews University. I also won't hold that against him because we all know Oakwood is the best, where he received his bachelor's in English Composition and Communications and a master's of Divinity. And he also has his doctorate. He is an ordained pastor, licensed counselor, author, and family life educator. Kamala T. Smith is an empath who is gentle and heartfelt in her mission to mentor and motivate. Kamala has a passion for studying social disparities and advocating for social justice and equity. She believes everyone should be afforded the opportunity to live purpose-filled lives in their community. Prior to making a career shift to Christiana Care, Kamala directed a mental health residential program serving individuals with serious and persistent mental illness. After 20 years in behavioral health, she began working at Christiana Care as the Director of Community Education and Engagement. She holds a Master's of Education from Wilmington University, and we thank her for coming out to our church today. Tiffany Shawwells is a licensed school-based therapist. Since 1999, Tiffany has provided therapeutic services to a diverse population of individuals and families in various settings. She has a cognitive behavioral approach with students to help reduce symptoms of mental health conditions. A Delaware native, Tiffany graduated with a Bachelor's of Sociology from the University of Delaware and a Master's of Social Work from Temple. Today, Tiffany's passion is providing clients with tailored services to meet their unique needs and help them meet with success in the community. All right, so what we're going to do is go ahead and get started with our Kahoot. My faithful Pathfinder assistants will go ahead and put that up on the computer. If you have your phones or an iPad, you want to join with us, you just go to kahoot.it and put that code in. And then you can, as the questions pop up, put answers in. You all looking at me crazy. I know you all have used Kahoot before. No, Sister Shawwell. I have seen people older than you master technology. All right, so if you'd like to join with us, just get out your phone or your iPad, go to kahoot.it, and put in the PIN number there. Then they'll ask you for a little nickname. And what we're going to do, as each question comes up, you can give your answer. If you want it and you don't want to do the Kahoot, you could just think of the answer yourself. Shout it out. We're going to be informal down here as we just try to learn some more about mental health. The number is 405-4651. 405-4651 at kahoot.it. All right, we got a few more people. I'll give it another 30 seconds or so, and then we will go ahead and get started. So what will happen is different scenarios will come on the screen. I will read them. You can read along with me. And then our next screen will have some answers for you to choose. And we'll see. I've been told some of what I chose as answers was incorrect. But we will discuss and learn together. All right. So Lydia, let's go ahead and get started with our first slide. Okay. Your mom died over a year ago, but you cannot seem to move on. The grief seems overwhelming at times. You're not hungry, and people comment you look too skinny. You do not want to get out of bed some days and are in danger of losing your job. Friends are telling you they are praying for you, and you are praying for yourself. However, you feel like God is not listening. You have thought about a counselor, but Black people don't see therapists. You want to feel better, however, you just don't know how to do it. You should. All right, here are options. The red one, continue as you have been, the blues will pass soon. The blue, pray harder, much prayer, much power. The yellow, go on that dream vacation you've been saving for. You just need a break. And then the green one, seek professional help in addition to prayer. The doc is in. Green, some are saying green, okay. All right, I think we've got another 60 seconds for people to pick. Anybody think it should be anything else? Which part? Oh, does anybody think it should be any of the other choices? The green one. Okay. All right. All right. Lydia, we can go ahead and hit skip now. We've got all our answers. All right, so most people chose the green. Now, that's what I chose too, but Dr. Defoe, you kind of think maybe should be a little bit different. So why don't you give us an idea first, why you think it should be all of them, and then if you could talk to us about how we know when we need professional help.
Yeah. So, Erica, it's not that I don't think that that D is the right answer. One thing that we have to be very careful with in helping or in trying to deliver support to grievers is to be prescriptive in our grief. We can't prescribe how or what someone should do as they navigate, a world that doesn't exist, never existed before. So D is the correct answer, yes. However, if going on vacation will help you, go on vacation. If A, which is, I can't see that. What does A say?
Which is continue as you have been.
Continue as you have been, minus the last part. The last part of that was what?
The blues will pass soon.
Yeah, that may be a lie. It may never pass. Grief lives as long as love lives. If love never dies, grief oftentimes doesn't die. We grieve relationships, and we don't necessarily can replace those relationships. And so if there's people that are grieving here, understand that grief is the natural and normal response to loss. What that looks like is going to be personal. We can't prescribe that. No one has gone through exactly what you've gone through in your grief because no one has lost the relationship that you've lost. Even if two people lose the same person, the relationship is different. And we grieve based off relationships, not off of people or whatever. And then, of course, the second, can you read the blue one?
The blue, pray harder, much prayer, much power.
Yeah, there's nothing wrong with prayer, but prayer can't be the only thing that we access. All right. The question also mentioned you having lost your mother a year ago. Even though we don't prescribe time or we don't associate time with grief, the DSM or the pathology that is related to prolonged grief, after 6 months, which is absurd, they say that you should be beyond certain things where there's not certain impairments that exist as it relates to your grieving experience. Well, prolonged grief occurs after 6 months. And so prayer is definitely a coping strategy that you can utilize. Going on vacation is also a coping strategy that you can utilize, as long as you don't think going on the vacation is going to mitigate or diminish the pain. Prayer is not going to mitigate or diminish the pain either. Oftentimes, in order to deal with grief, we have to sit and be present with that grief. We have to allow the grief and the sadness to overwhelm us. What we do typically with grievers is we tell them to shut off their grief, or to shut off their silence, or they do it by themselves, or to not cry. All those other kind of things. Yeah, none of that works. Don't tell that to people. Even at funerals, you telling people, oh, they're in a better. Well, we don't tell people that. Well, God's had a plan, and don't worry, you'll see them again. That doesn't help someone in their grief. We don't help people navigate their grief by connecting to their head. We help them connect with their heart, and the only way we can do that is to feel our way through grief. And I think I talked too much.
No, that was fine.
All right, good.
Kamala, so do Black people use therapists? And are there resources in our community where we can obtain professional help?
So I want to say that I yes?
Oh, 405-4651. Go ahead, Kamala.
I want to say that I do agree with the doctor. All of those things can help with grief. But I also want to share with you that you have to feel what you're feeling, right? So whatever you're feeling, feel that and be able to identify what it is that you're feeling so that you can get past what you're feeling, right? So do Black people use therapists? Yeah, we do. We do use therapists. Sometimes we use them in a professional setting. Sometimes we use them in just an organic setting. So I might be getting therapy from my sister right here just by having conversation with her. So sometimes we take this word therapy and we make it a doctor-patient type of relationship. So anything can be therapeutic. Your vacation can be therapeutic, right? So do we use therapists? We do. Do we need to use them more? Absolutely. Absolutely. Do we need to take the stigma out of getting in contact with a therapist? Yes, we do. Do we have to let people know that this is what you need to do for right now? Absolutely. And is it okay? Absolutely, it's okay. Because how are you going to sit in your pain if you don't have somebody to escort you out of your pain, right? So that's what the therapist does. They help you to escort you out of your pain. You can't sit in that. And if you are, is that working for you? If it's not working for you, then you got to do something different. So there are resources out there. So I want you to write this down. If you have pen, if you have your phone, I want you to write down Black and Brown Therapists of Delaware. When you go to that website, it will pull up Black and Brown Therapists here in Delaware. It's a whole portal where therapists go on and get connected so that people can find therapists that look like them. What I also want you to do is if you're seeking therapy, I need you to identify your why. Why are you going to therapy? I don't want you to just go sit in a therapist's office and then, because that costs. There's money attached to that. So you need to write out your plan as much as you possibly can. Write out your plan before you go to therapy. Why am I going to therapy? What am I seeking from therapy? What am I looking for from the therapist? What do I need my therapist to look like? How old do I need my therapist to be? All of those things you want to identify so that when you go in front of the therapist, you can say, I'm having a difficult time with grief. I'm having a difficult time with loss in my life. So to help me to navigate that space. Do you touch other mile markers while you're there? You absolutely will, because other things will start to kick up. Another thing that I want you to realize and to remember, if you do access therapy, it's not for the faint of heart. So when you go to therapy, it doesn't mean that things get easier right away. It doesn't mean that your walk is just going to be like, oh, I got this now. You're going to probably go through some quicksand. You're probably going to go through some mud, but you have to go through all of that to get to the other side, right? And we know in obedience, there's something on the other side of obedience, right? So if in your heart of hearts you're saying, I need to go to therapy, there's something on the other side of that obedience, right? After every storm, there's a rainbow, right? So get to your rainbow. Get to what that looks like on the other side for you. And don't feel ashamed because you need help. It's okay to need help, okay? The other thing I want to share, churches have a resource called Grief Share. So if you're going through a time in your life where you're grieving things, let me share this. Grieving is not just from a loss of a person. Grieving can be from a loss of a job. Grieving can be from a loss of a relationship. You can grieve more things than someone just passing away, okay? So know that grieving is not prescriptive to just someone dying. So Grief Share gives you the tools that you need, and it also builds community with other people who are grieving, because support comes in so many different packages, right? So Grief Share is another option for someone that is going through loss. All right.
Tiffany, do children sometimes need to receive professional help? And should they seek help in school or outside of school? All right. Do children sometimes need to receive professional help? And should they seek help in school or outside of school?
So I want to say changes in your child's personality can leave you wondering, does my child need therapy? Sometimes these changes become prominent as a result of a traumatic experience, while other times they can emerge unexpectedly. Regardless of the reason, these changes are important to pay attention so your child can receive help. Can you hear me? I'm sorry. Here are 11 signs that may indicate that your child could benefit from counseling. Has problems in multiple areas of life, such as family relationships, academic performance, leisure activities, and friendships. Make comments like, I wish I weren't here, nobody would care if I ran away. Has repetitive self-destructive behaviors such as hair pulling or skin picking. Starts feeling bad about themselves, less confident or less effective. Withdraws from family, friends, or activities they used to enjoy. Has a significant change in sleep habits or appetite. Shows excessive worry about the future. Engages in negative behavior more frequently. Talks explicitly about suicide. Expresses hopelessness. And talks about or engages in any kind of self-harm. So there are ways to seek help. Mental health agencies contract with alternative and public schools and therefore provide mental health services to the students. Parents seek suggestions from a guidance counselor, and the guidance counselor will refer the client to a school-based therapist. Once the client or the parents fill out the paperwork, then the client will get on a school-based therapist caseload, and then they can see the student, and then they can diagnose the student. Parents can also consider asking the child's health professional or clergy person for thoughts and recommendations.
Okay, go ahead and hit next. All right. Your 14-year-old granddaughter has come to your home to visit while her parents are away on a 7-day cruise. You normally have great visits with your granddaughter. However, this time you notice she seems sad and withdrawn. Her parents had mentioned to you she was having problems with bullying in school, and you wonder if this is the reason for her sadness. On the second day of your visit, while at dinner, you ask your granddaughter how she's doing. She tells you she hates her life and just wants to die. When you tell her it will be fine and things will get better, she says she has no friends, school sucks, and she would be better off dead. You should Okay, here are options. All right, tell her she should not say such things and send her to her room. That's red. Blue, tell her you will pray for her and she should pray too. Yellow, wait until her parents return and tell them about the conversation. Or green, call 911 or take your granddaughter to the nearest hospital or children's hospital. So what should you do? Tell her not to say such things and send her to her room. Tell her you will pray for her and she should pray too. Wait until her parents return and tell them about the conversation. Or call 911 or take her to the nearest hospital. Lydia, you can go ahead and hit skip. All right, okay. So most of you said call 911, and then one person said wait until the parents return. So Dr. Defoe, what would you advise us to do if our child or our granddaughter comes to us and is saying, our grandchild is saying those types of things?
The answer is supposed to be D.
But go ahead.
Uh, so let me give this disclaimer really quickly. I have no proficiency with children. I have a 12-year-old daughter, and I don't understand her. So I can't seek to. Yeah, it's not my wheelhouse. So, however, if I were to see an adult who expresses suicidal ideations, the first thing is, it is normal for people to want to give up. It's not abnormal. However, there are some things that we need to do to follow up to make sure that the person actually intends to harm themselves. Simply stating that they want to harm themselves does not mean that they have the intent, sure. That does not mean that they have the plan, nor do they have the means. So it's walking a fine line. If you're not able to make an appropriate assessment, then calling 911, or better yet, taking the child to the emergency room for assessment may be better than calling 911, because we black, we don't really want to call the police on our children. However, if you do believe that the child has the intent to carry it out, or they have a plan, asking them, do you intend to kill yourself? Asking the question doesn't put it in their minds. Asking them, do you have a plan, or how would you go about wanting to do it? If they have answers to those questions, then yes, it's time to call the police. And so that's my response, to figure out what some of the risk factors are. Teens and children go through a lot of changes. We know there are a lot of exigent circumstances, that there are changes in behavior, there are changes in family relationships, there's changes in their body, there are changes in their cognitions or their thought processes that confuse children a lot. And so it is very important that if your child ever expresses these ideations or these thoughts, that you do get them connected with professional help, so that it is you don't make them feel like, oh my God, you shouldn't do that, God loves you, we should not. That's not really the right response. Making sure that, one, you protect them and you protect their lives, but two, making sure that they are connected to the appropriate helping structures or helping mechanisms. There's also, if you don't want to call the police, there is also now a national, oh, sorry, that's not my job. Sorry. Yeah. Pass it on. Pass.
Yes.
Dr. Defoe was about to go.
Yes.
Correct what I said. I don't know.
What I will say is, if your child does do that, take it seriously, right? Like, just telling them to go to their room does not solve the problem or what is going on in their thought process, right? So take it seriously. The other thing is, you might not be that person. You might not be the person that has the connection. Yes, you're the parent, but you might not be the trustworthy person that they want to share that with, right? So make sure that make sure that your children always have a safe person. Make sure they always have a safe person. So if you know that riles you up and you can't talk about depression, who's the safe person that can talk to them about that? Because it might not be you, and that's okay, that it might not be you. Like, my husband was not the one to do reading. He was the one to do math. So I didn't try to do math because that's not my space, right? When it comes to homework. So know your space. Know where you can offer the most. As far as resources, instead of 911, I would recommend that you call 988, because 988 is the mental health emergency number. So those individuals that are on that other end of that phone, they are equipped to answer those questions, right? And triage it to where it needs to go. So if you need to go to the emergency room, or if you need to go to crisis or anything like that, those individuals are trained to be able to walk you through those processes. In addition, I would suggest, if you have a child who might be experiencing some things, your school is your first resource. Your school is your first resource. You need to let the school know that something is going on with your child, so that you can have a partnership with the school. So whether that's through the school counselor, whether that's through the school-based wellness center, make sure that you have a connection with the school. The school-based, some schools, majority of schools in Delaware have school-based wellness centers. I'm sure that's where Tiffany kind of has some of her work coming through, but in that school-based wellness center, there's a team that will wrap themselves around your child. So there's a therapist there, there's a nutritionist there, and there are things where another group of people that I work with, which are called community health workers. So those community health workers will be the ones that are working directly with your child. They're not case managers, they're not care managers, they're not social workers, they're trusted individuals that have communication and dialogue with your child to be able to connect them to resources that work for them. So.
All right, Tiffany, I know this is slightly off what we have, but just going off of what was said, if we seek out school, is it reported negatively in our children's record? Does it affect them in the long term? Are there any concerns about reaching out to the school?
Repeat that one more time.
So, as Kamala was saying, she said reach out to the school. So my question is, if I do that, is it negatively reported in my child's record about that I've reached out?
So I think that that's a great question. I think it's a cultural question, right? Because in our culture, we tend to think there's this stigma with help. And there's not a stigma with help, right? So if your child is going confidently to someone, that's not something that needs to be in a record to carry them to college and high school and stuff like that. The goal is help. That is what the ultimate goal is, for them to be able to get help. So I'm going to say no. I'm going to say that it does not negatively affect them. I think it positively affects them to be able to get help as far as their life circumstance. You say something different?
No, I agree.
Seen an uptake in depression amongst kids since COVID-19, and if so, why do you think so?
Okay, so I'm going to report some statistics. So according to the National Library of Medicine, research on suicidal ideation and suicidal behavior in very young children is scarce. However, in clinical settings, child psychiatrists encounter these constellations repeatedly. Okay. Although death by suicide before 10 years of age is rare, suicidal thoughts and sometimes behaviors do occur. According to National Library of Medicine, suicide affects people of all ages. So in 2021, suicide was among the top 9 leading causes of death for people ages 10 to 64. And suicide was the second leading cause of death for people ages 10 to 14 and 20 to 34. Mental health problems such as anxiety and depression were shown to be increased substantially post-pandemic. Recent data specifically for children and adolescents found the global pooled prevalence of depression and anxiety to be 25.2% and 20.5% respectively. According to National Library of Medicine, increased social isolation is a well-known risk factor for depression and suicide. Compared with before the pandemic, children were spending less time with friends and family members in person, less time outside and being physically active, and more time using screens. Virtual schooling led to fewer opportunities for children to connect with caring adults, such as educators and coaches, who often serve as important sources of support. Some children lost loved ones due to COVID-19. Moreover, pandemic-related impacts of poverty, food and housing insecurity, and loss of health insurance coverage place additional stressors on families. As youth face increased risk of factors for poor mental health, they concurrently face a loss of access to mental health services. Over half of adolescents who receive mental health services in the United States depended on school-based services, but access to these services was markedly reduced during transitions and virtual schooling. During the pandemic, youth also faced reduction in access to primary care and community mental health services.
Question. Your spouse is acting strangely. He sometimes mixes up the grandchildren's names. However, he now seems to be forgetting their names and mixing them up more often. He is moody and becoming increasingly withdrawn. The other day he went to the store and it took him hours to come back. He confessed he had trouble remembering how to get home. You also notice he's forgetting to take some of his blood pressure medications. You should. All right, the red. Do nothing. A little forgetfulness is a sign of old age. Blue, make an appointment with your husband's PCP or primary care physician. The yellow, buy him some vitamins to improve his memory. And the green, take your husband's keys and tell him you will be driving him everywhere from now on. All right. All right, go ahead and hit skip. All right, so Mo said make an appointment with your husband's PCP. So I'm going to open it up to all of you on what you can tell us about dementia and the types of resources we can seek for help with our loved ones who are showing signs of dementia.
I think we will all agree up here. This is not my wheelhouse. Like dementia is not my space. I've worked with dementia clients, but I am not an expert in this space. What I do know is that the primary care physician is the first course of action, right? Making sure that you have contact with the primary care provider. By show of hands, how many of you in here have a primary care provider? Because I would be remiss coming from Christiana Care not making sure that you had a primary care provider. Okay. And if you don't, see me. If you don't, see me. But primary care should be the first course of action. The other thing that I want to share is that if medication is required or medication is recommended, take the medication. Take the medication. Some of us sometimes, I don't want to take any medication. But if your body, how can I say this? If say somebody is like 65 years old, right? And some things are starting to break down. Think about that as if it was a 65-year-old car. Would you be able to keep a 65-year-old car moving without oil, without gas, without those things? You wouldn't. It's the same with our bodies. It's a 65-year-old body. These feet and these legs have been holding you up for 65 years. This brain has been trying to remember things for 65 years. That's a long time. So sometimes we need the extra help, which might be the medication, it might be the therapies, all of those things, and don't be ashamed and apologetic about having to take those things. But PCP should be your first course of action.
Well, I never came across any students in reference to, personally, I haven't come across any students with dementia, but it is true that children can suffer from dementia. So again, I'm going to report some facts to you. Can everybody hear me? Okay. According to Verywell Health, childhood dementia refers to progressive brain damage caused by certain rare genetic disorders. So children with childhood dementia are born with the underlying conditions. It is not contagious. Symptoms of childhood dementia may include confusion, loss of memory, or the inability to communicate. The symptoms are progressive, meaning they get worse over time. Symptoms may progress quickly or slowly depending on the cause. Children with childhood dementia are born with the underlying condition. It is not contagious. The symptoms of childhood dementia are caused by brain damage that worsens over time. It is common for children to lose skills that they previously developed or mastered. And they may include memory loss, confusion, inability to concentrate, personality changes, hyperactivity, and inability to regulate emotions. So depending on the underlying cause, children with child dementia may also experience the following: seizures, loss of vision, loss of hearing, and immobility. Children are usually diagnosed following tests by a specialist team or a children's hospital. If a parent is concerned their child is showing signs of dementia, it's best to first connect with a GP who would make a referral for further investigation.
PCP is the first contact. Okay. All right. We're going to go to our last question. Yes. So the question was, Kamala had mentioned the Black and Brown Therapists of Delaware.com, and Pastor Ferguson wanted to know if there was a similar resource for finding physicians of color. And the answer is no.
Nothing is coming to the top of my head, but that doesn't mean it doesn't exist. So that means I need to do some homework to try to get something to Erica for you. Or create.
I know when I wanted to find one, I just kind of Googled and then looked at images and tried to figure out, or I would go to Bay Health, look through their doctors. So that's how I did it. I couldn't find a website either, so that's how I had to do it.
And your insurance company will print out a list of primary care physicians in your area based on your zip code. So if you call your insurance company, you can get primary care physicians in your area by zip code, but they will not specify.
No,
They
you'll
will
then
not
have to go look at
specify.
images of those people.
And when I talk to you about BBDT, that's the Black and Brown Delaware Therapist, if that's not your jam, that's okay too, right? But you can also go to psychology.com, and that will give you therapists as well. And most of the time, you'll see their profile, you'll see their picture, and they'll give you their contact information. What I want you to keep in mind when you are looking for a therapist, and say you're looking on the Black and Brown Delaware Therapist portal, or you're looking on psychology.com portal, if you're not seeking a therapist for substance abuse, don't go to a therapist that specializes in substance abuse. So they're going to have it on their profile what they specialize in. So some might specialize in children, right? Some might specialize in depression and anxiety. So that's what you want to look at too, right? So it's as if you're shopping because you're getting ready to share your intimate stuff with somebody, okay? So you don't want to, for lack of a better term, waste time. So when you're looking at those profiles, if you know substance abuse is not what you're seeking, don't go to somebody who specializes in that.
All right, so our last question. Go ahead and hit next, whoever's helping me out. And hit it again. Okay, last one. You feel angry and anxious so much lately. TV is full of bad news. Your family and friends are constantly coming to you for help or advice, expecting you to assist. Your spouse is sick and you're having to care for him on a constant basis. Money is tight, and although you are meeting your bills, there is nothing left for fun activities. Church is on Zoom and you feel disconnected. You should connect. Oh, I'm sorry. Okay, you should connect with people more. Consider attending church in person or finding local cheap or free community groups to join and activities to attend. The blue, cut back on the news and internet. Dive into God's word and pray more. Yellow, look into respite care for your loved one. Green, help family and friends when you can, but don't overextend yourself. And the light blue, all of the above. All right, I think that's it. Oh, okay. Most of you said all of the above, and then one said help family and friends when you can, but don't overextend yourself. And please, from a legal perspective, please do not co-sign for your relatives. Do not co-sign for your relatives, especially if you are on a limited income, my senior citizens. Please do not co-sign for your children. Please don't. Okay, anyway. From the clinical medical perspective, we said all of the above. Is that correct, Dr. Defoe?
Yeah, it seems correct. The funny thing about anxiety is the most common occurring disorder, mental health disorder or condition in the U.S. The National Association of Mental Illness estimates about 18.1% of the population experiences an anxiety disorder. 50% experience that anxiety disorder before the age of 14, which lets you know that children with anxiety occurs oftentimes at a very young age. Anyway, there are numerous warning signs of anxiety, but most of us have some level of anxiety. Anxiety is what allows us to regulate the protective factors in our brain, right? So all of us have some amount of anxiety. However, when anxiety becomes disabling, so it affects our ability to live, to laugh, to love, to learn, meaning to go to work, to engage in meaningful relationships, to have the proper affect, or to be able to have the right affect, and then what's the learned one? To cognitively process and think, or we're not able to think, so we have a fuzzy brain, or we have forgetfulness and stuff like that. Anxiety is very normal and natural. However, when it does come with impairments in our ability to maintain relationships, to handle our daily routine and activity, then we may have an anxiety disorder. You're not alone. Anxiety also is the number one co-occurring disorder with other disorders. Oftentimes, if you have depression, anxiety is its partner. If you have a substance use disorder, oftentimes anxiety comes along with it. They tell you that maybe perhaps you have a substance use disorder because you have anxiety or you have depression, and so you've now turned to substances to sort of mitigate the impact of the anxious symptoms or the depressive symptoms. Yeah, did I answer the question, Erica? Yes, you did. Is it resource time? Yes. Pass.
Hello? I think the resources are the same. The Black therapists. I also have this up here. This is one of my teams at Christiana Care. It's our health guide program. So the health guides are just that. They guide you through health. And they're at the Wilmington Hospital, but they're not limited to the Wilmington Hospital. So I have this flyer up here for you. It has their email addresses on there. If you are having financial burdens when it comes to your health care, they can help you with that too. Like if you have bills or anything like that, they can help you with that process. They can also connect you to a primary care doctor or any kind of specialty practice. So I wanted to leave this here as a resource. I went to a health fair yesterday, and this is another resource for counseling. So it's the Diamond State Counseling Service. And two of those young ladies left their card and their information with me. And I thought of you yesterday, so I wanted to bring it here for you. And also, I don't want to be remiss. I know this is not one of the questions, but women who are expecting, carrying children, they also face some emotional concerns when they're carrying children. So I also wanted to give that resource as well for expectant mothers.
So according to Healthline, anxiety affects people of all ages, including kids. So approximately 7.1% trusted source of children aged 3 to 17 years old have diagnosed anxiety, according to the Centers for Disease Control and Prevention. So if you're noticing an increase in fear, stress, and worry in your child, you might be wondering whether they're dealing with an anxiety disorder. So being able to identify the signs and symptoms is a critical first step in helping your child with anxiety. So some of the general symptoms of anxiety are excessive fear and worry, often related to family, school, friends, or activities. Worry about things before they happen. Low confidence and self-esteem. Physical symptoms such as stomach ache, headache, muscle aches, or tension. Fatigue and restlessness, irritability, changes in appetite, lack of concentration. And if irritability and inability to relax, trouble sleeping, and nightmares, fear of making mistakes or being embarrassed. CBT is considered the gold standard for treating anxiety. According to a 2015 review, trusted source, several key components of CBT can help children manage anxiety symptoms. These include educating children and caregivers about anxiety, teaching techniques for managing symptoms, using cognitive restructuring to challenge anxiety-provoking thoughts, exposure to fear situations, and practicing problem solving for coping with anxious situations. Another one is mindfulness training. It's an intervention that may also help children manage anxiety symptoms. Another one is medication. Prescription medications like SSRIs are often reserved for more serious cases of anxiety or in situations when using the two together seems appropriate. And then they mentioned the SSRIs, Prozac, Celexa, Lexapro, Zoloft, and Paxil.
Oh, go ahead.
Anxiety is not a bad feeling, right? It's not a bad emotion. I think I would speak for all of us. We've all felt anxiety at some point in our life, right? Whether that's a temporary thing or you're up against something that you have to present or something, we've all felt anxiety. We've all felt it. But when it's that feeling that's persistent and it doesn't move and it continues to stay on you, that's when you need to seek help for that, right? Because anxiety is a natural emotion. It's natural that you feel anxiety because it's getting your body prepared for something that you don't know. It's getting your body prepared for a place that you've never been, right? So we all feel that. But when it's a feeling that you constantly feel, right? When you have that spirit of worry, you need some help, right? You need some help with it because you need something to help you, to push you past it, okay? So I want you to know, just when you feel like that little anxiety, that doesn't mean like, oh my gosh, something wrong with me? No, might not be, but might be too, I don't know. But I just want you to know that it is a feeling that we all experience. You are not alone if you feel anxiety.
Okay,
would
so
that
that was it for my questions. We have a few minutes if anyone in the audience has a question for any of our panelists. Pastor Ferguson.
Thank you, Andrew. Is there a legitimate concern that, I'll just shoot straight at it, boys of color may be overly prescribed for the kinds of medications that Tiffany mentioned? Is there any legitimate concern out there for that?
Overprescribed? Probably not. Overdiagnosed? Yes. And overdiagnosed with the wrong things. We have seen a significant rise in oppositional defiant disorders being labeled on our black boys specifically. Well, we know from research that that's the pathway to prison. That if I give you an ODD diagnosis early enough, I can get you into jail. And so that's something to pay attention to. But in terms of the ADHD and the ADD diagnoses and the medication that is supplied for it, I'm not a doctor, so I would recommend that if you're prescribed medication or that you have a child, specifically a young black boy that's prescribed medication for his inability to focus or for hyperactivity, right? And you've tried things like sports and karate, things that will help them balance their mind and their body together, regulate that connection. After you've tried those things, the medication is useful if it helps. And then, figuring out, having open conversation and dialogue with their doctors about it so that you don't enter into problems where the child has more behavioral issues because they either can't focus or because they're too advanced for where the classroom is. Testing is very important. Getting access to testing that is culturally sensitive and culturally appropriate, specifically for young black men, is also very important. That directory that she mentioned probably has some good resources also for that as well. That's all I'm gonna say about that, because yeah. Overprescribed, no. Overdiagnosed, yes. Yeah.
Testing. Yeah, the question is, if I heard correctly, is that y'all recommend medication. Okay, but it was one of the courses recommend. One, absolutely, I'm on point. However, you heard of the expression, your food is your medicine and your medicine your food. And it's by a doctor, I can't put his name up right now. But anyway, because see, as we know and we eat the food that God has provided for us to eat, and we do it on a continual basis, it tends to keep us healthy, you know, and a lot of stuff that we can take, it will be just as therapeutical as medicine that's prescribed by the doctor. Because food is your medicine, medicine your food. I just want to hear your opinion on that. Whoever want to answer that question for me.
I wholeheartedly agree with you. Food is medicine, right? But everybody's not eating the right food.
Correct.
So if you're eating the right food, I applaud you. But everybody's not eating the right food. And that's because some of our communities are food deserts. So you can't go to the store and get fresh produce, or you can't go to the store. Like, we're eating a lot of processed foods. So food is your medicine, right? So take care of your whole temple. Take care of your whole thing. So I agree with you.
One more statement and I'll be done.
Oh, wait, hold on. We had someone else who wanted to comment on what you
All
just
right,
said.
I didn't know. Thank you.
What is your name, ma'am?
My name is Ella Roy.
Ella Roy. Sister Roy,
Yes.
I'm going to handle this from the spiritual side of this.
Yes, sir.
There are some things that medication, people cannot regulate certain things without medication. I want us to be incredibly clear. If your doctor has prescribed you medication, speak with your doctor about your desire to utilize food as your medication in addition to your regular medication. However, if you've been diagnosed with a significant mental illness, a persistent mental illness, schizophrenia, bipolar, a personality disorder, please take your medication. And then let me say this as an Adventist pastor talking to Adventists. A part of the pathology that is involved with persistent mental illness is hyper-spiritualism. So we typically hyper-spiritualize because we are sick. I'm not saying that's the case here, all right? As a pastor, whenever I go into a church, I look in Sabbath school and Pathfinders to find all of my sick people because that's where they flock to. Not saying the Pathfinders and the Sabbath school folk
Sabbath
are.
school, Dr.
Yeah,
Moore. I teach
and you're the Pathfinder leader too, right? But that's not. Listen, I want you Adventists to hear me good, because it breeds and lends itself to instability. Now, listen. Take your medication if you've been prescribed medication if you have those illnesses and those diseases. If it's for depression, if it's for anxiety, then by all means discuss with your doctor and have conversations with your doctor. Bring it to a nutritionist. However, if you suffer from persistent mental illnesses, make sure you take your medication because you're going to end up in the hospital. All right? Do we understand one another? All right.
I just want to be clear, that was not a license to not come to Sabbath school.
No, I'm just.
That was not a license to not come to Sabbath school.
I'm just saying that's where you'll find them, Erica. I'm just saying. Take it from me. You know, I've had 11 churches now, and all the time, as a clinician, all the time, don't worry, that's where they are because that's where they're drawn to, and it's perfectly okay. I'm just letting you all know that it's a breeding ground for people who experience hyper spirituality. It is a part of the pathology of those diseases. I had a member one time wrote an adaptation of the Bible, and it was 780 pages that he literally wrote. He was not spiritual hearing from God, he was sick. Do you understand me? All right, good. That's the pastor talking. All right.
Okay, ma'am, you had a question.
I just want to be, I'm
One-
thankful for the information that I've received, but I recommend 2 books. Mind, Character, and Personality, written by Ellen G. White, and The Ministry of Healing. Those books will also help you. So it's Mind, Character, and Personality, and Ministry of Healing. And the seminar is talking about the mind. So that's a perfect book also that you can read to deal with the mind. All right, thank you.
Okay. Oh, sir, hold on. Let's get you a mic. And then I see you, Sister Shawwells. We got a couple more minutes. Okay. So I have 3 questions, and I think that's it. Okay.
I have a friend who's been in and out of treatment. Friend is suicidal at times. Is bipolar. Suffers from depression.
A little bit more volume.
Suffers from depression, and a friend of mine has been in and out of treatment. And lately, my friend was talking about suicide and different things like that. We have tried to talk her to get into a lot of another rehab program, but she's been in so many. We don't know really what to do if this is going to work, and it's kind of scary. So, is there? I don't think there's a quote unquote place where you can go and just, you know. You have a question about that? That they feel like they've been everywhere and done everything. So even though they're going to treatment, it may not still be an option for them because they still want to use. So I don't know what to do.
So is it, you're asking like, where can you go when
Yeah,
you've
where
tried
can my
everything?
friend go, yeah, when they feel like they tried everything.
Where's your friend located?
Atlanta.
Do you all know resources in Georgia?
I don't, but my question would be,
Well, what I'm saying is there some type of facility, another type of facility they can go to that might be more suited toward whether should it be a long stay, than maybe 30 days, 90 days, or something like that. Maybe it has to be a year program or something like that. They have to really be clean and be.
so substance
in a
abuse is
relation-
involved?
Yes.
Okay,
Drugs, pills, crack, you name it.
okay. And they're also bipolar?
Yes, and suicidal.
Okay.
It's a hard cocktail there.
Yeah. There are longer term stays, hospitalization stays, but the person has to be willing, right? They have to be willing to be hospitalized. But the person has to be willing to be to be hospitalized. And what happens sometimes, I'm not saying that this is your friend, but when a person is dealing with substance abuse and also has a mental illness, those 2 things are fighting each other. Like they're at war. So there's like war inside of the person's head. So they may be taking the medication as prescribed, but then they're also counteracting that medication with the substance. So I think it's the matter of like how much the person wants to do it, but there are longer term stays.
Sister Shawwells.
This is baffling situations and it concerns suicide. We've had some high-profile suicides in this country, and people, including myself, have known people who have committed suicide with apparent no symptoms. Is that common? Or the things that people miss?
So I guess the question really is suicide, do people always show symptoms so that you can help prevent it?
Well, we know suicide is preventable. However, you can't prevent what you don't know. You can't prevent. There's some individuals that they will let you know that they have the thoughts or they have the plans because they actually want help. And then there are those really that you don't expect or that you don't suspect would ever even think about that. Like what was that purse lady, the lady who owned them?
Oh, Kate Spade.
Yeah, Kate Spade. No one ever assumed that someone with, so much money and resources, so we can't really say, okay, this person seems like they may be suicidal. This person is in danger. It's a silent disease as well. But I want us to be very, very clear that suicide is oftentimes a result of a larger illness. It could be depression, it could be something else, all right? Oftentimes we don't get the warning signs. But when we do get the warning signs, we have to take it serious, all right? But sometimes we don't get the warning signs. Ultimately, people do have that freedom of choice. But for some people, they're not making a conscious choice. It's their illness that's making their choice. And so we don't really know. I think that's the best way that I could possibly answer that for you, is that sometimes we can miss stuff. Sometimes we don't have enough care and concern. Half the times we experience guilt after the fact because we think of the things that we could have or should have done. But in the end, we're also not God.
Thank you, but I know that it leaves the remaining loved ones that's so devastated.
Sure. Yeah, as with every death, except for that comes with guilt. That comes with, questions.
Yes. Unanswered
Yeah.
questions.
Yeah. But, all grief comes with unmet expectations. So, yeah, it's hard. And so that's the important thing of having spaces like this where people who they need help can know that they can find help in safety. That's why being actively engaged in tearing down the stigma that exists in our community as it surrounds mental health and seeking help is very important, that people know that they won't be ostracized, that there is help available to them if they so choose. Now, some people will still not choose. Right, so we have to just all we can do is provide space and safety for people. Yeah.
Okay, Sister Sheena, we've hit our hour mark. You are our last question.
Oh, thank
I'm
you.
so sorry. I don't want to keep our panelists too long.
Oh.
Sister Sheena, go ahead.
Yes, thank you. I appreciate all the resources for children and students in the public schools. What about schools that are not in the public school? Are there other resources that those schools could reach out to assist their children?
Adventist up here?
Yeah.
Okay, so if you go into, so you're talking about Adventist schools, right?
Or any private school.
Or any private schools? Well, I can only talk about the Adventist ones. We don't do real good with wraparound services in the Adventist church. We're good with education, we're not good with wraparound services, all right? And so we have to make sure that we provide the tools necessary for our parents and our students to have access to resources. So I know here in Allegheny East, we've provided resources specifically on my department's webpage and then also on the School of Education's page, where we've tried to supplement some of the lack of wraparound services with resources on that website, right? For those of you who are here that are, we mentioned the Black and Brown database. If you're looking for Adventist clinicians, specifically if you go to the Relationship Ministries webpage of the conference's webpage in Delaware, there's a whole section in Delaware that includes Adventist clinicians that we've provided for you. I don't subscribe to you need to have an Adventist clinician. Anyone who's not Adventist, block your ears. We believe weird stuff. And so there is some catharsis. Calm down. There's some catharsis that we have in helping other people understand some of the stuff that we believe. So I've noticed when I've sat down with other Adventist clients, I don't have the curiosity to dig or help them dig into their faith that they say is a large part of their pathological response to problems, because I have an understanding of the crazy stuff that they also believe. So oftentimes, when we have to explain to our therapist, it actually provides us with some catharsis because we then begin to understand it better ourselves. If I have to explain something that I believe to someone, it helps me process it better. And so just finding someone who believes your belief system is not all that serious. Find someone who has the capability and the competence to help you. If they're Adventists and you want to talk to another crazy person, then let's find another crazy person. We crazy people can talk together. Is that all right? We family. I'm an Adventist pastor. I
Dr.
can call us
Defoe,
crazy.
We're
We crazy.
gonna tell your wife what you said today.
She crazy too. All right. No.
All right.
You know what I mean.
Yeah.
When I say, if you understand, there's some nuances that we believe as a part of our faith that are not easily understandable by other people. Do not rob yourself of the catharsis that you're going to need to describe that to someone else by only seeking someone who believes your same faith system. All right? That's the same thing without insulting
We talked
you all.
about that in Sabbath school today. Moving past your comfort zones. All right, ma'am. Our last question.
Pastor,
Sister Roy, you went already.
no. Something I want to.
Oh boy. Yes.
Okay. I want to ask about something specifically about assessment that you said.
Yes.
You know, just to shed a little bit more light on it, in terms of cultural sensitive assessment. Anything particularly you would recommend for black teenagers in terms of assessment that maybe as a black clinician I can focus on in working with my black or colored population?
Like assessment
Particularly
meaning
with assessments, because you were saying one of the things that you would recommend would be assessments, cultural appropriate assessment, something like that.
Oh, yeah, that's not you gotta yeah. Uh-huh.
I know that they're the general assessments,
What-
right? When we do, or when I think you said testing. Sorry.
What kind of
not-
Yeah.
assessments?
not
Are you talking
assessment.
about for kids
No,
or?
no. Well, specifically, I'm thinking about teenagers,
Okay.
right? But you did say testing; it wasn't assessment. Sorry. Is there something particularly that you know of that could be better, a better type of assessment,
For what
or testing
for what type of pathology
For
or
like-
diagnosis? 'Cause
Well, it's for the ODD we were thinking about, right? Very often they're misdiagnosed. They're given all these different, the ADHD, there's the ODD, there's the and the gamut
offhand-
goes on, right?
Dr.
offhand-
Defoe,
offhand, no,
my
yeah.
sister-in-law's a school psychologist. She can help you out on this one.
Oh, good,
gonna
yeah.
pass the
Why?
mic.
Yeah, why is she sitting up here?
So, in regards to culturally sensitive assessments, I would recommend what we consider, I work in DC public schools, a comprehensive psychological evaluation. You would get some information as it relates to the student's cognitive development, how they take information in and give it back in return, how they process it. You would look into the student's working memory. You would also look at their verbal skills. So there'll be a cognitive assessment along with testing that looks at the academic skills and social emotional functioning. Within the social emotional functioning of an assessment, it will look at oppositional defiant disorder. It will look at ADHD. It will also look at some executive functioning. And together, all of that information will drive what type of results that you will have. How is this student being directly impacted in the classroom? How are they directly impacted as it relates to their relationships with others? How are they directly impacted in their home environment? When it comes to comprehensive evaluation, psychological evaluation, if it's important to you for the child to have a psychologist who looks just like them, you can make that request through Psychology Today. That's a website that you can go on. You can get an idea of what the psychologists look like, their areas of expertise, and you can ask questions related to that psychological evaluation. I am very culturally sensitive when I conduct evaluations with students. I ask a lot of questions about trauma-informed data, what kind of home experiences they've encountered, how does that impact them at home and at school. So it's a very involved process, but I would definitely start with Psychology Today. We'll give you a breadth of information as it relates to that kind of testing. Does that make sense? Your question is probably a little bit more involved.
Yes.
So
It's
we can talk
Thank you.
offline if
Yeah.
you like to. Okay.
Thank you.
I can't believe you sat here and watched us struggle all that time, and you could just help us so long ago. But thank you, yes, because
All right.
no, Obviously not.
Okay. I think that was all of our questions. I want to thank each of our panelists. I got some information that I'll keep it out if anyone wants to pick it up, and then we'll also leave it. We'll leave it here at the church, and we'll bring it out on Sabbath, or if someone wants to reach out to me for the information. So again, thank you all. Go ahead.
And I just want to say thank you to you, Erica, for you and your team who pulled this together, because these are conversations that need to happen in all congregations, right? This needs to happen because this is where the community starts. And if you get that here in the community, then you can take it out into the street. So I thank you for doing this.
All right, thank you all. I think you've already had your dessert. I saw it being wheeled around. So you're dismissed, free to go. I hope you save some dessert for the panelists.